Let's talk about a virus that is, without a doubt, one of the deadliest pathogens known to science, Marburg. The big question on everyone's mind is, could this be the next global pandemic? Well, we're going to break down the facts and find out. To really get why this virus is so terrifying, you have to start with just one number, 90%. In some outbreaks, that's the fatality rate, a 90% chance of not making it. It's just a staggering figure that puts it in a league of its own. So with a death rate that high, it's pretty natural to ask the big question, could Marburg go global? Could it really become the next COVID-19? That's the exact question we're here to answer. Okay, so first things first, let's really get a handle on what we're dealing with here. I mean, besides that horrifying fatality rate, what is it about this virus that makes it so incredibly dangerous? Marburg causes something called a severe viral hemorrhagic fever. Now, if that sounds familiar, it should. It's in the exact same family as Ebola. And because it's so deadly, the World Health Organization calls it a priority pathogen. Basically, that puts it on a very short, very scary list of diseases that pose a massive risk to public health. And the way this disease progresses, it's just brutal and fast. It starts out with things that might sound common, like a sudden fever, really bad weakness, and headaches. But it can escalate, and fast, to bleeding and total organ failure. It's an incredibly aggressive illness. And here is where we get to the absolute heart of the matter. A virus can be terrifyingly deadly, for sure, but lethality by itself does not equal pandemic potential. Danger alone does not make a pandemic. You need something else. And that brings us to the most important factor of all when you're talking about pandemics: transmission. How does the virus actually get from one person to another? This right here is the crucial difference. Let me be perfectly clear on this because it is the single most important fact in this entire explainer. Marburg is not an airborne virus. You can't catch it just by being in the same room as someone who has it. So how does it spread? Well, it takes direct physical contact with the blood or body fluids of a person who is sick. It can also spread through surfaces that are contaminated with those fluids, or tragically during unsafe burial practices. The virus actually lives in Egyptian fruit bats. That's what scientists call its natural reservoir, and it jumps to humans in what's known as a spillover event. So here's the bottom line. Because it needs that kind of close physical contact, Marburg spreads way, way slower than a respiratory virus like the flu or COVID. It just doesn't have that invisible, fast-moving transmission that you need for a true pandemic. Okay, so with all that in mind, let's just lay out the evidence. Here are the main reasons why public health experts are so confident when they say a Marburg pandemic is highly unlikely. When you put them side by side like this, the difference is it's night and day. A pandemic virus, it's typically airborne. Marburg needs direct contact. A pandemic virus can be spread by people who don't even know they're sick. With Marburg, you're only infectious when you are visibly, physically ill. And, maybe most importantly, Marburg makes people so sick, so fast, that they often can't even travel. This helps contain the outbreaks, keeping them local and slow, not global and fast. So if the global threat is low, does that mean we can just ignore it? Absolutely not. And this is where the conversation has to shift, away from a global pandemic and toward a different but still very, very serious threat, a regional emergency. And that's a fair question, right? You might be thinking, okay, if it's not going to spread all over the world, why does it get so much attention from groups like the WHO? Why should we really be worried? Because under the wrong conditions, a small outbreak can absolutely become a devastating regional crisis. Just imagine places with poor infection control in their hospitals, a lack of basic protective gear, or weak systems for tracking diseases. In those situations, the virus can spread like wildfire. And this risk gets even bigger because of things like deforestation, which pushes back colonies and people closer together, making those first spillover events more and more likely. This is exactly why the best defense isn't just about treating sick patients. It's about preventing the fire from starting in the first place, using a strategy that's known as the One Health approach. The whole One Health idea is built on a really simple but powerful truth. You cannot separate the health of humans from the health of animals and the environment we all share. They're all connected. They are three parts of one big system. A problem in one area, like a disease spreading in animals, is going to end up impacting the others. It's inevitable. So what does that actually look like in the real world? Well, it means we are actively monitoring wildlife, like those bat colonies. It means we're educating communities about the risks of touching or eating wild animals. And, so critically, it means we're making our own human health systems stronger with better hospital infection control and surveillance systems that can spot an outbreak the second it starts. It's a defense on all fronts. Okay, let's pull all this together. It's time to circle back to that big question we started with and give you the final verdict based on everything we know. So, can Marburg become a global pandemic? The overwhelming consensus from scientists and public health experts is a clear, simple answer. Highly unlikely. The way the virus is built, the way it spreads, it's just not designed for global domination. So the most important thing is to understand a threat for what it is. The risk of a global pandemic? Very, very low. But, and this is a huge but, the risk of a severe, deadly, devastating regional emergency, that risk is high, especially in places without strong public health systems. That's the real danger zone. And because that regional risk is so real, we just can't afford to let our guard down. Continued vigilance, being prepared, and working together on that One Health approach are absolutely essential if we want to prevent future tragedies. You know, Marburg itself might not be the next big one, but its existence is a powerful, scary reminder that as long as humans and wildlife keep getting pushed closer together, the risk of a new virus spilling over is always there. So the question we're left with is this: Marburg is contained for now, but what's the next spillover? And will we be ready when it comes?